What's up, guys? I was doing a live with Dr. Patella, and I'm gonna try to send this to him right now. Maybe we can go live on mine. How's it going, guys? We were just doing a live with Dr. Patella, and right when he was saying, oh, there we go, Dr. Patella. Let's request to join, Dr. Patella, and then I'll there. Alrighty. Shit. Hey, Adrian. There we
Hello.
go. Okay, perfect. All right, so for those of you who may have not heard, who may have not seen what we were talking about, I asked Dr. Patella, why is it that he doesn't prescribe finasteride? That was one, because he doesn't usually prescribe finasteride. He's one of the few doctors who doesn't. Then I also asked him, what are his thoughts on topical finasteride?
Yeah,
And
my answer is a brief disclaimer before.
yeah.
I'm not telling the surgeons that prescribe finasteride are right or wrong, but my medical opinion is that the cons of prescribing finasteride are not enough for me to prescribe them. So uh, actually, you have a very few percentage, a very short percentage of side effects with finasteride, sexual side effects.
Mhm.
But when you start the clinical treatment for androgenetic alopecia, you must be aware that you should carry this treatment for a lifetime. So if you start today, keeps it for 1-2 years, and then stop, the thinning process will still be happening, and then androgenetic alopecia will thin all your hair away. Of course, depends on your genetics. So you should not consider start using today and then stopping when you have the full
Yeah,
head of full of hair with a
yeah.
transplant. You must keep the treatment for lifetime. So if you use finasteride for maybe in the youth, 30 until 40, 45 years of age, okay, no problem with finasteride. But after that, maybe you get some side effects, and
Mm, okay.
I
So you
don't think this is interesting.
that you don't you don't feel so comfortable prescribing it because of the long term, how long a patient has to use it, right? Because they have to use it not just for 10 years, 20 years. I mean, in order for them to really gain the benefits, they have to use it for the rest of their lives, right?
Yes, yes. And if the patient in 5 years feels some sort of side effects, such as loss of libido or reduction of the sperm volume, this patient will give up all the treatment he's done.
Mm,
So he won't even try finasteride, minoxidil. He won't even try anything. Okay. So I think the cons are not enough for me. And I have another ethical question with
mm,
finasteride, that I do not use finasteride.
mm,
I would not use finasteride, and I won't use finasteride. So I cannot prescribe for a patient of mine
mm.
some medication I would
That
not use myself. Okay, so I understand that it's much more difficult for me to achieve a good result without using finasteride. I
mm.
understand that perfectly. And thus, I must rely only on my surgical skills in order to achieve this goal, this good result. Okay, so this is what I think about dutasteride and finasteride, and there are recent articles that say it may have some relation with anxiety and depression and
Mm.
some sort
Yeah,
of disorders.
yeah, cognitive, like the cognitive disorders and stuff like that. Even uh, you may develop higher chance of dementia. They're saying, um, you know, so what are your thoughts on? because this is what, and I'm going to play devil's advocate, but this is what people are going to say. They're going to say, well, aren't you worried that some of those hairs that you're extracting will thin over time because your patients aren't on finasteride? And they're going to say, well, maybe you should do FUT because this is a more safe zone. What are your thoughts on that?
Well, as far as the patient is using topical or oral, especially oral minoxidil, he's doing what he can do in order to try to avoid this. Okay, so he's doing his best to try to avoid this thinning of the donor.
Mm.
It may be something natural that happens over the age, but there's no solution for this. Okay, so as far as he's doing his role on this treatment, we should be, accept that. Okay, if it thins a little bit,
Yeah.
but he should try plenty of other things such as the LED light,
The laser therapy.
also PRP and mesotherapy, and but
Yeah.
even so, I wouldn't prescribe finasteride. Even so, I think
Yeah.
the cons are not so good, and the pros are not good enough for me to prescribe it.
And I respect that. And I personally don't take finasteride. I tried it, and I got bad side effects. But I've been considering the topical finasteride, and I'd like to get your thoughts on that. The topical finasteride, you're not ingesting it. There's a much lower absorption rate, so your systemic DHT is reducing about half as much as the oral finasteride. Do you think maybe sometime down the line you may reconsider maybe prescribing topical finasteride? Or what do you think?
I don't know. I don't know because you have indeed a low absorption rate of the finasteride molecules, so it won't be that efficient as an oral finasteride. Okay, so if you can try to use topical minoxidil or even oral minoxidil, it would do almost the same thing as a topical finasteride. I don't know. It lacks scientific comparison between these treatments, as
Yeah.
far as I know.
Yeah, I mean I think oral minoxidil is definitely fantastic. There's a couple train of thoughts, right? A lot of people say that if you don't treat the DHT attacking the hair follicle, that's the main thing. So you have to treat that. And I understand that. But I also see that oral minoxidil is definitely really good. And it I've seen it replenish the donor and make it a lot healthier in many ways.
Yes. By the way, do you have any way of getting this oral minoxidil in America? Because here in Brazil, we have in the Spanish countries, Latin countries, you have this pharmacy where you can ask for certain formulas, such as 2.5 milligrams minoxidil, and they will produce the capsule with this substance. How does this work in the US?
It's very difficult. You have to go to a doctor. They have to prescribe it. They have to prescribe you Lonitin, which is the oral minoxidil.
Yeah, you still have Lonitin in the industry in the
Yeah,
US. Oh, great.
yeah, we have Lonitin, but it's not, a lot of doctors will not prescribe it to you because it's a blood pressure medication and here, and they will say, if your blood pressure is okay, we're not going to prescribe it to you for your hair. So it's very difficult to get. So, we usually use the topical, which is good, but not as effective. But yeah, I think I really feel like that a lot of people wanted to know that, why you don't prescribe that. So I'm happy to hear that because honestly, I feel that that's a very ethical thing to do. And your response was who can argue with that? If you wouldn't feel comfortable as a patient taking it, why would you prescribe it to a patient? Nothing else to say.
Yes, not necessary.
Yeah, that's completely ethical. I think that I can't say anything else. You know, if you wouldn't take it yourself, then how could you give it to someone else?
Yes,
So
yes.
I agree with you with that. And if
There's
take it,
yeah, there's something interesting that I notice when the patients come to the consult. When they use finasteride and get some sort of side effects, uh, it seems to be much more than it is described
in the
uh,
literature,
in the literature. Yes, of course, it's not a scientific. I'm just giving my opinion, but
yeah,
it's really frequent. It's really frequent. At least the side effect of a loss of libido, because it is indeed a subjective feeling. I'm feeling that I'm not, but you can lose libido for
yeah,
any reasons. But the patient starts to feel this. I'm not, I'm not feeling like chasing
yeah, yeah.
around. Yeah,
It could, and it could be a lot of people that are very pro finasteride, and I'm in the middle, right? I tend to be in the middle. I think if finasteride's working for you, you're not getting side effects, fantastic. If you don't want to take finasteride, you have your reasons. I respect that too. You know, I respect many point of views, but I think sometimes some people may develop what's called like a nocebo, which is like, it's like if I told you that this pill will make you super strong, and then you take it and then you go to the gym, and
yeah,
in your mind you feel like I'm
yeah,
gonna be,
yeah.
so they may take this, oh, it says that I'm gonna lower my libido, and then they take it and it just kind of happens. So but
Yeah,
I do agree with you that the percentage that they say in literature of the 3% or 2%, it's much higher than
yeah,
that. I would say probably like 15%. It's a
yes,
number.
much
It's
more
not,
like it.
yeah, it's not super low, but I always say, look, if you want to try it out, and you've done the research, you've weighed the pros and cons, and in your mind you say, you know what, my hair is important, and try it out. Try it out. If you get side effects, stop
Yes,
using.
yes, yes. Of course, if the patient comes to me and he's already using finasteride,
Yeah,
uh, if another doctor have prescribed it to him, I can't tell him not to use. I
yeah,
would just give my advice, okay,
yeah,
and explain him that if he feels something, he may stop it, and he must understand that his hair will fall off with the interruption of finasteride or dutasteride. And if he understands this well, he will start another clinical treatment with minoxidil and also with oral minoxidil and, biotin,
yeah,
whatever he may try.
yeah.
And also another very important thing that I'm noticing here, especially nowadays in Brazil, is that people is using a lot of testosterone reposition. I'm
Mm.
not sure if you have this in the US.
Yes, yes, yes. So testosterone replacement therapy.
Yes, 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 perfect.
Yeah, yeah,
Testosterone replacement. And when you do this, your hair will just thin away. And they are not doing for, I could say, not for medical reasons, but for
for
aesthetics.
yeah, aesthetics.
Yes, for muscle. Also
You want to
creatine and
look good at
also,
Ipanema. They want to look
yeah.
at Ipanema, right?
Come to Brazil eventually, please. I host
Yeah.
you.
Yeah, we have the same thing here. You'll go to like gyms and stuff like that, and they have the guys who they don't make money off of working out. They're not like trainers or anything, but they do this,
Yes.
they do the testosterone and stuff just to look good. And yeah, it has a detrimental effect on their hair follicles, especially if you have the gene.
Yes,
100.
yes.
Yeah, no, I agree. Well, Dr. Patella, thank you so much. We've been on the call for a little bit over than what we expected, but before we
This
go,
is great. This is great.
yeah, and I had a fantastic time. We should do this like at least monthly, and
I
next time
agree.
we'll do an open Q&A so that people can ask questions openly. But before I let you go, where can patients find you? Where can they contact you if they have more questions, or if they had a question here they couldn't get answered? Where can they find you?
Well, they can. in my profile, I think Instagram, I have pretty much everything covered here, and he can direct message me. My team will answer him with a form in order he can reach us more easily. Okay, so also there is a contact in my profile in which you can just text or call us for scheduling an appointment or surgery. Okay, it's not
Okay.
that hard.
So at Dr. Felipe Patella, Pittella,
Yes.
is your Instagram handle. And do you have an email that patients can email you?
Yeah, dr.felipepitella
P
at markgmail.com.
Very important. It's two T's. I
Yeah,
made the
two T's
mistake.
and two L's.
Two T's, two L's. So Pittella. For a long
Yes.
time, I was sending emails to Dr. Patel, and I was like, why isn't he responding? And then he's like, it's two T's. So, okay, great. Uh, this was fantastic. You guys
Yeah,
be sure to follow Dr. Patella.
yeah, and my followers also, please follow Hair Transplant Network profile. And I strongly recommend my patients to enter the forum and make a review about their surgeries. I have nothing to hide, and daily I'm posting those cases, and they can just go there and tell the world how is their surgery going. So
Yeah.
it was a very good time talking with you, my friend.
I welcome all of Dr. Patella's patients to the forum, hairrestorationnetwork.com. All right, Dr. Patella, till next time.
See you. Bye bye.
All right, bye-bye.